When you first learn the gluteus medius, you are often taught one main thing: it abducts the hip. That is not wrong, but it's also nowhere near the full story. The gluteus medius has an important role in walking, running, standing on one leg, and controlling the position of the pelvis. Different parts of the muscle may also contribute differently depending on the position of the hip and the direction of the fibres. So in this video, we are going to look at where the glute medius originates, where it inserts, and what those attachment points can tell us about how the muscle functions. I'm Jen. I'm a sports injury rehabilitation student, personal trainer, sports massage therapist, and biomechanics coach. This video is part of a short series designed to help students, clinicians, and coaches learn anatomy by understanding it rather than trying to memorize long lists of disconnected facts. Let's begin by locating the gluteus medius. Glute med is found on the lateral surface of the pelvis. It sits underneath the gluteus maximus, although part of it remains relatively superficial towards the upper and outer part of the hip. To understand its origin, we first need to look at the ilium. Now, the ilium is the large, broad upper portion of the pelvis. The glute med originates from the external surface of the ilium between the anterior and posterior, front and back gluteal lines. It also has attachments associated with the gluteal fascia. From this broad origin across the outside of the pelvis, the fibres travel downwards towards the femur. The muscle inserts onto the lateral surface of the greater trochanter. Now, the greater trochanter is a large bony prominence which is found towards the top and outside of the femur. So, in simple terms, the glute med runs from the outside of the pelvis down towards the top of the femur. That gives us our first clue about its action. When the pelvis remains relatively fixed and the muscle contracts, it can pull the femur out to the side, which is what creates hip abduction. That is the action most people remember, but anatomy becomes more useful when we look beyond the most obvious movement. The glute med is a broad fan-shaped muscle. Its fibres do not all run in exactly the same direction. The anterior fibres are positioned more towards the front of the hip, the middle fibres run more vertically, and the posterior fibres just sit further down towards the back. Now, because the fibres have different orientations, they're going to have different mechanical contributions. The middle fibres are well positioned to contribute to hip abduction. The anterior fibres may actually contribute to hip flexion and internal rotation, and the posterior fibres at the back may contribute to hip extension and a little bit of external rotation. However, it's important not to turn this into another oversimplified list. Muscles do not work as separate switches where one section performs only one action. Their contribution changes depending on joint position, task, load, movement speed, and which other muscles are active. The important lesson is that glute med is not simply a single direction hip abductor. Its structure allows it to contribute to movement and control across several different planes. So let's look what happens when your foot is on the ground. If you lift your right leg out to the side while standing, the right glute medius can help abduct the right hip. That is an open chain action where the femur is moving relative to the pelvis. But during walking or running, the situation is actually often reversed. Imagine standing on your right leg and lifting your left foot away from the floor. Gravity will tend to pull the unsupported left side of your pelvis downwards. The right glute med must produce force to help control the pelvis and stop it dropping excessively on the left side. In this situation, the femur is relatively fixed and the muscle is helping control the pelvis. That's why glute med is often discussed in relation to single leg stance, walking and running. It's not simply moving the leg away from the body, it's helping manage the relationship between the pelvis and the femur. That distinction matters because muscles can behave differently depending on which attachment point is relatively fixed. When we learn anatomy, we often imagine the origin as completely fixed and the insertion as the part that moves. And that can be helpful as a starting point, but the body doesn't always move that way. Sometimes the pelvis moves relative to the femur. Sometimes the femur moves relative to the pelvis. Sometimes both are moving while the muscle helps control the relationship between them. This is one reason anatomy should not be learned as a completely rigid set of rules. The attachment points help us predict what a muscle may do, but function also depends on the task. The glute med is frequently blamed for all sorts of movement patterns. You might hear that somebody has knee pain because they have weak glutes. You may see a knee move inwards, going valgus during a squat, and immediately be told glute med isn't working. You might even see exercises prescribed specifically to activate the glute med as though it's somehow switched off. This is usually too simplistic. Movement is influenced by many factors, including strength, coordination, anatomy, balance, confidence, pain, fatigue, speed, task demands, and previous experience. A visible movement pattern doesn't automatically tell us that one particular muscle is weak. It also doesn't necessarily mean that the movement is harmful. Understanding the anatomy gives us useful possibilities, but it should not encourage us to make confident clinical conclusions just from one observation. That said, understanding glute med can help us think more clearly about exercise selection. If we want to challenge the muscle, we might choose exercises involving hip abduction, single leg support, or resistance that creates demand on pelvic control. Now, this could be sideline hip abduction, standing hip abduction, lateral step-ups, split squats, single leg balance tasks, or loaded walking variations. But the best exercise depends on the person and the goal. A sideline leg raise might create a direct hip abduction demand. A single leg squat may challenge the glute med as part of a much larger whole body task. A lateral step down might involve strength, balance, coordination, and confidence, as well as hip muscle function. And none of these exercises are automatically better. They simply create different demands. The anatomy helps us understand those demands. It doesn't tell us that everybody necessarily needs the same exercise. Another common idea is that we can perfectly isolate the glute med. In reality, most movements usually involve multiple muscles. During hip abduction, the glute med may work alongside the glute minimus, tensor fascial latae, and other muscles contributing to the pelvis position and control of the hips. It's not a problem. The nervous system usually coordinates muscles together to complete a task. Our goal does not always need to be perfect isolation. It might simply be to create an appropriate challenge for the movement or capacity that we want to develop. So let's return to the anatomy. The glute medius originates from the external surface of the ilium between the anterior and posterior gluteal lines. It inserts onto the lateral surface of the greater trochanter of the femur, and because it crosses the lateral side of the hip, it can contribute to hip abduction. Because it's broad and fan-shaped, its differently oriented fibres may also contribute to rotation, flexion, and extension depending on the position and task. When the foot is on the ground, it can help control the pelvis relative to the femur, and that makes it particularly relevant during walking, running, and single leg tasks. This is a process I want you to use when learning any muscle. Start with the origin, find the insertion, look at the direction of the fibres, identify the joints that the muscle crosses, and then ask what will move if one attachment is fixed and the other is pulled towards it. After that, consider what happens when the movement is reversed or when the limb is in contact with the ground. That approach allows you to reason through anatomy instead of just relying on memorizing actions. And it can also give you a stronger foundation for understanding exercise, assessment, and rehabilitation. But anatomy still has limits. Knowing the glute med does not allow us to diagnose the cause of somebody's pain from a photograph of their squat. It doesn't prove that a particular movement is dangerous. And it does not mean that every person with hip or knee pain needs glute strengthening exercises. Anatomy is one part of the picture. It is an important part, but it should sit alongside the person's history, symptoms, goals, beliefs, movement options, and response to loading. In the first video in this series, we looked at why muscle origins and insertions are so easy to forget. The main message was that anatomy becomes easier to retain when the attachment points, actions, and movements are connected. The glute med is a good example of that. Rather than memorizing only that it abducts a hip, we can follow the muscle from the pelvis to the femur and think about the different ways those structures can move relative to each other. In the next video, I'm going to show you a simple system for learning anatomy and actually remembering it without repeatedly starting from the beginning. I have also created a full anatomy course that works through muscle origins and insertions in a clear, structured way. It is designed for physiotherapy and sports rehabilitation students, clinicians, massage therapists, but it's also designed for personal trainers who want to strengthen their anatomy knowledge without simply staring at lists. You can find the course and my anatomy and key resources through the links below. Before you move on, take another muscle that you're currently learning and ask yourself 4 questions. Where does it originate? Where does it insert? Which joints does it cross? Which direction will it pull? Those 4 questions can tell you far more than simply memorizing one line underneath the word action.